Welcome to Voices, a televised production of the Atlantic Caribbean Union of Seventh-day Adventists. We are so proud to be representing the islands of the Bahamas, Cayman Islands, and the Turks and Caicos Islands. We are in our 8th season, and this is still the beginning of the new year. And I am certain, like me, very many of you watching have had the opportunity to set goals. We call them goals because we seek to accomplish them. However, for whatever reason, we can't seem to always start and finish that diet. Or we're going to exercise a bit more. We want to be healthier, happier people. We want to drink water, but for whatever reason, we can't get it. But we are focusing on this edition on healthy living, and more specifically, colon health, to help us with that in knowing what it is and understanding how we can better improve that aspect of our body. We have in studio Dr. Flloyd Carter. Dr. Carter, welcome to Voices.
Thank you. Thank you for having me.
It is such a pleasure to have you here. Now, for the benefit of myself and those viewing, can you please just give us a brief description as to who Dr. Carter is?
Well, I am the second of 3 children born in the island of Barbados. I have an older brother and a younger sister. I have since moved to the Bahamas, of course, where I now call Bahamas my home. I'm married with 2 very active sons. As far as I presently serve and worship at the Ephesus Seventh-day Adventist Church.
Okay.
And as far as my medical training, I graduated from the University of the West Indies in the class of 1999. So I've been practicing medicine for close to 19, 20 years. I went on to further specialize in internal medicine and came back to the Bahamas to practice as an internist, and then fell in love with gastroenterology. So after a few years, then I went on to further study and subspecialize in gastroenterology in Canada, and graduated in 2006. Since then, I've been working as a gastroenterologist here in the Bahamas.
Okay, well, you are very much equipped and educated and learned to advise us on colon health. So, I am not certain where in my body the colon is, but I do know that it's inside. Can you please tell me what is the colon and what is its function?
Okay, I guess the simplest way to put it is that the colon is a tube-like organ that is at the end of the digestive tract. If you imagine the digestive tract as starting at your mouth, where you put everything in,
yes.
both things you should and you shouldn't, and everything you eat and drink, you start in the mouth, you chew it up, start the digestive process in the mouth, mix it with the salivary secretions, and then that is passed down through the esophagus into the stomach. The stomach is a muscular organ. It basically contracts and breaks the food up into smaller particles, turns it into a semi-solid mush, and then it passes it on to your small intestine. Now that is the workhorse of your digestive tract. It is there where all of your nutrients and the vitamins and minerals, things that you want to get from your food, is absorbed, the final point of your digestion, really. At the end of that, what you're left with is liquid waste, stuff that you couldn't digest, and stuff that is probably excess food. That is waste, and that waste is passed on to your colon. So your colon, some people call it also the large intestine, basically functions as a way to change that liquid waste into solid waste. That's its main function, converts liquid waste to solid waste. But in addition, it can do certain things, like it can digest certain carbohydrates, particular fiber, particularly with the bacteria that line the colon. That's one thing people don't understand. The colon is lined by millions of bacteria, most of it good, and it's very important for colon health.
It is. So I just want to hit on that a little bit because when I think about bacteria, I think of something being nasty and bad for me. So we have good bacteria as well?
Of course. The entire GI tract has trillions of microbes. And many people call this a forgotten organ because without it, we will die. So we live on a day-to-day basis in a symbiotic relationship with trillions of bacteria in our gut. And those bacteria is very important for normal health. Anything that disrupts that balance can make us very ill. Okay? Most of the cases of diarrhea and gastroenteritis is because of a disruption in that balance.
Oh, okay. So it seems like I need to ensure that I keep myself as healthy as possible.
Yes.
But how can I do that? What steps or what food should I or shouldn't I eat in order to best take care of that area, that forgotten organ?
Yeah, so as you said, the colon, sometimes we take it for granted. Many people think about their heart, they think about their brain, and think about their limbs that they move. And we forget about the colon until something bad happens. Then we suddenly realize how relevant it is. To keep the colon healthy is similar to your general health. Number one, that you should exercise. Okay? Exercise is essential because it brings more blood supply and oxygen to every organ, and the colon is the same. So with more oxygen and blood supply, the colon is able to function much better. Number two, exercise helps the colon to move. So in general, we recommend people to have regular exercise. It doesn't take a lot for your colon health, but in general, you should be getting 150 minutes of exercise a week, which is about 30 minutes, 5 days a week. And that will improve your colon health. And other things too. So one, you want to make sure that you eat a diet that is rich in fiber. That is probably one of the most important points in having good colon health. Because fiber allows your colon to move things along. Without fiber, things get slow, and there's a possibility of constipation, as we normally say, when you don't move frequently enough. And that can lead to a lot of problems. So the fiber allows you to bulk your stool up. And bulkier stool is actually easier to pass than narrow stool, one.
I would never think
Right.
that.
And two, it allows you to retain water into the stool and thereby allows the stool to pass out a lot easier. So a diet high in fiber is essential.
The colon sounds so intimate, if I dare say, because it seems as though it's responsible for so much.
Oh, yes, it is. But there are other things, before we go on, that is also important for your colon health. Water, as you mentioned, is important. And being hydrated is essential. But if you're dehydrated, what the body does is that it tries to get as much water as it can from your stool. So in the end, you end up with very hard stool that's very difficult to pass. Other things are also important. Vitamin D is very
Sunshine?
important. Yeah,
Oh.
simple sunshine, but you'll be surprised. Many of us here in the Bahamas are deficient in vitamin D. Why is that? Because most of us spend our time
Inside,
indoors.
in an office or somewhere.
Correct. And believe it or not, a lot of people actually require a vitamin D supplementation. And that is essential if you're not getting enough sunshine to make sure the colon functions well. And there's one other thing that I will mention. Some people always ask about colon cleansing. Should I get my colon cleaned? And I get asked this question many times a week. And it's a difficult question to answer, mainly because we have very little scientific evidence to support the habit of cleaning the colon. And number one, we started out by saying that the colon basically expels waste.
Yes.
So the idea of keeping the colon clean
Yes.
is kind of a tough concept to grapple with. The most important thing we have to make sure is that the colon is functioning normally. I normally do not recommend colon cleansers, except in a few situations where cleaning the colon is necessary for a procedure, whereby we need to see the colon. But other than that, I tell people that they should avoid it if possible.
Wow. I am so accustomed to saying pastor. Maybe that's prophetic.
Oh,
but
please.
Dr. Carter,
Yeah.
I do appreciate all that you've said thus far. And can you believe that we are already about to take this break? Ladies and gentlemen, we will be right back. Please stay tuned. Please call a friend because this information is very important to your health and your life. Stay tuned.
Jealous for me, love's like a hurricane. I am a tree bending beneath the weight of his wind and mercy. When all of a sudden I am unaware of these afflictions eclipsed by glory, and I realize just how beautiful you are and how great your affections are for me. And oh, how he
Welcome back. We have been having such a wonderful discussion on the colon, of all things, imagine, with Dr. Carter. Dr. Carter, you essentially would have left us telling us to finish our goals.
Yes.
Drink the water, get the sunshine, exercise, all for the betterment of our colon.
Correct.
Things that we would, I'm sure, not associate with that part of our body.
Yes.
But it sounds like it's so very important.
Very.
So I am certain that there are persons who are watching whom might have had a family member who either has or had colon cancer or something to do with the colon being not well. So what role does family history or genetics play in colon health?
Well, knowing your family history is essential. There are some conditions that, as we say, run in families with regard to the colon. And you mentioned one is colon cancer. Having a first-degree relative, a mother, father, brother, sister with a history of colon cancer definitely increases your own personal risk of developing colon cancer. Another point is that even the history of colon polyps, which are precursors to cancer, having a family history of colon polyps also increases your risk. So you need to know that, because that might mean that you should be the person who should never take the colon for granted and make sure they get the necessary testing. There are some other diseases that we associate with families also. And we call those the inflammatory colon conditions. And we call them like terms of it, such as ulcerative colitis and Crohn's disease. Those conditions also have a genetic component in that. If you have a family member with those conditions, your own risk also increases.
So, Dr. Carter, you would have just made mention of some of the diseases that can come about as a result of an unhealthy colon. What are some of the issues, outside issues that can also occur as a result of this?
Yes. So there are many symptoms that can occur from an unhealthy colon. From the very minor problems such as bloating, which a lot of people report, or that all-common gas that people complain of, to abdominal pain, to the actual conditions or diseases that you can develop. Number one is constipation. Constipation is a big problem. And number one, defining what it is a problem, right? So let's say, for instance, what may be normal for you, bowel habit that is, may not be normal for me. So everyone is different when it comes to bowel habits. So typically we will say that if you're having a bowel movement that is from 1 to 3 times a day to as little as 3 times a week, that is within normal range. Constipation, therefore, will be if you're moving your bowels less than 3 times a week. Or when you do go, you have difficulty passing stool. There's straining, or the stool becomes hard, or it looks different, comes out looking like hard balls and so forth. That is what we will call constipation. That is very common, but likely in many cases not too hard to treat.
Okay, it seems as though having bowel movements is such an important thing.
Oh, yes. Yes, but you can imagine it, if you imagine the colon like a tube or plumbing fixture.
Right.
If something gets blocked or slowed, the whole system is affected. And believe me, when somebody has significant constipation, you can't be at your peak.
Optimum,
so
yes.
having normal colon function, regular bowel habits is essential.
Now, Dr. Carter, I need you to lay this home for myself and the people. How common is colon cancer in the countries of our region?
Okay. If you look worldwide, let's compare it to worldwide stats. If you look at the males worldwide, the top cancers are prostate cancer, then we have lung cancer, then colon cancer. Colon cancer is top 3 worldwide for men. And worldwide for women is breast cancer and then colon cancer.
Oh, wow.
Top 2 for women, that's worldwide. If you look at our statistics here in the Bahamas per se, in males, we have prostate cancer being the most common, then we have colon cancer. Second most common cancer in males, okay? In females, we have breast cancer, of course, cervical cancer, then colon cancer. So in all genders, colon cancer is a top 3 cancer, and that is worldwide in the Bahamas. And the situation is similar to the other regions that the union serves. In Turks and Caicos, top 3 cancer, and in the Cayman Islands, we assume it is, but unfortunately we don't have enough statistics to back that up at present.
Dr. Carter, I actually find those statistics to be rather interesting because the colon, as I said, is really something that we tend to forget. And so for that to be one of the top 3 in both women and men, I think you said second for men and third for women, obviously, again, there has to be a special emphasis on this organ.
Of course, of
But
course.
can you tell me why? Why do you think we take it for granted? Because I do believe, maybe because breast is so common, in terms of cancer, it's really in your face that we tend to remember that and everything else is just pushed to the side.
I think we pay an emphasis on breast cancer, and quite rightly so. Breast cancer in our region is some of the highest in the world. We know that in the Bahamas, we have the highest prevalence of inherited breast cancer worldwide. For this small country to be the #1 in inherited breast cancer rates is ridiculous in itself. So there's absolutely good reason to pay attention to the breast. But women should not stop with the mammograms. If you're concerned about your health, you should have your pap smears done, quite rightly, but with the vaccine now, which we call the HPV vaccine, cervical cancer rates are dropping significantly across the globe. So soon colon cancer is going to be the next cancer that women should worry about because it is in the top 3. So mammograms, pap smears, and think about getting screened for colon cancer. Because another point is that when you look at people dying from cancer, colon cancer is probably the second most common cause of cancer-related deaths that we see here in the Bahamas. Most common is we have prostate, and then we have breast and colon right next to each other. Okay?
Wow.
All right, so it's very important that you can't take this for granted. It's both common and it is lethal. But there's good news. Of those top 3, colon cancer is the only one that is preventable.
It is.
Yes, it is.
So that means I don't even have to worry about this if I do what, Dr. Carter?
I want to say you don't have to worry about it, but you should, if you know ahead of time that one of the top 3 cancers you have to worry about is preventable, it's something you shouldn't take for granted. And every time I diagnose a case of colon cancer, I'm depressed because that is a preventable case. The reason why colon cancer is preventable is because almost all cases of colon cancer start out as a small polyp, which is a small little growth in the colon. And it takes that polyp between 8 to 10 years. Yes, 8 to 10 years to grow into cancer. So we have that interval of time whereby we can intervene and prevent colon cancer. And that is the emphasis that we should make.
Prevention and not cure,
Oh,
as
yes.
some people say.
Yes.
Now, what can I do? What are some of these steps that I can take to avoid even having to ever, well, not think about it, but avoid dealing with this?
Yeah, so because it's preventable mainly because you can detect these lesions, which we call polyps, early. So we have colon screening techniques that are able for you to have an emphasis on colon cancer prevention. An important note here is that most of our screening techniques, breast, prostate, the emphasis is on early cancer detection. I think the emphasis for colon screening should be on cancer prevention. And basically, the technique that I have a bias to is the colonoscopy. The colonoscopy, and I can hear and feel people cringing at the same time.
I said it in
Right.
my head.
It's a procedure whereby a trained physician is able to place a special camera through the back passage and take a look along the lining of the colon Identify those polyps which are precursors for cancer and remove them. By removing that polyp, you can prevent that polyp ever developing into cancer. And once it's done in a reasonable time frame, you can safely prevent or at least significantly reduce your risk of colon cancer with a simple colonoscopy.
Dr. Carter, colonoscopy. Is there an age when people should start coming to have these things done?
Good question. So you have to ask yourself a few questions. Number one, do you have a family history? If you have a family history of colon polyps or colon cancer, the next question you should ask, at what age was that cancer diagnosis made? And if that cancer, and basically you should start your screening 10 years before that diagnosis was made. So for instance, if your dad unfortunately was diagnosed with colon cancer at age 50, your screening should start at age 40. Otherwise, if you don't have those risks, then you have what we call average risk. And average risk people should start their screenings at age 50 if they're white, and age 45 if they're blacks, like we are.
Oh.
Right? And the reason is that we know that black, both African Americans and Africans develop colon cancer earlier than our white counterparts, and it's much more aggressive. And that's why the recommendation is that we start 5 years earlier.
Wow. And of course, because this is in both men and women, you strongly encourage both men and women to go and have this done.
Of course. It's preventable.
Right.
It is preventable. And unlike the other screening tests where you probably have to do every year and so forth, one colonoscopy gives you a protection for 10 years. So a colonoscopy is recommended once every 10 years, once your first colonoscopy is clean. Of course, if you remove polyps, then your risk is slightly higher and the intervals are shorter. But there's no doubt, it's a no-brainer if you're worried about cancer prevention, you should have a colonoscopy in your plans if you're over 45. If you have anybody in your family in that age range and you care about them, you should be encouraging them to get screened.
Dr. Carter, now that is a note for us to end on. Encouragement, encouraging us to become healthier people, because as we both know, this is the Lord's temple.
Oh, yes.
And so in order for us to prevent even having to have this colon cancer, we can exercise, as you said, we can drink some water, we can get that vitamin D that we so need. We can come to you and have that procedure done that we won't say again. But there are things, all of these nuggets that you would have given us to help us to become better people, better stewards, as I'd like to put it. And so I just want to thank you so much for sharing that information. It really feels and sounds like you can give us so much more, but for right now, that will do. Ladies and gentlemen, thank you so much for tuning in. Again, this has been a production of the Atlantic Caribbean Union of Seventh-day Adventists. We are so happy to have you within the Bahamas, Turks and Caicos, as well as Cayman Islands watching as we represent you this and every day. Until next week, stick to those goals. Get that exercise, drink that water, and be a good steward to man and to yourself. Your body's temple is the Lord's. Until next time.